we're going to do the bone segmentation and just kind of play with that. And then we're also going to do about that alignment and how to see when it's incorrect and how to fix it. All right, so we're going to start with surgical guides. We're going to start with import CT scan, just like before. Our case for this one is the DiagnoCat bone segmentation file. And we're going to find our CBCT in here. We're going to hit OK. This is the file we want. OK. So this is where we crop rotate. We're not going to do either. We're just going to hit OK. We're going to bring in the whole CT scan. OK. So the very first thing we're going to do is I'm going to bring in just my intraoral scans here. So let's do this. I'm going to hit Import STL Model. I'm just going to bring in the just the upper one first. We're just going to keep things simple. So under our folder, we have all of our various files. I'm looking for the upper jaw intraoral scan. So this is the patient's intraoral scan that was taken with my intraoral scanner. And I'm only going to bring in this one file to start. I'm going to tell it it's a maxilla. Now, the very first thing it does, it says alignment. This means it's trying to do the auto alignment function. If I knew it was going to fail, I could just hit cancel and then go align it how I wanted to. But we're going to let it run the auto alignment because 9 times out of 10, the auto alignment is great. It does great, especially when they have all natural teeth, not a lot of metal and stuff. It just does its thing. But it always warns you, make sure to confirm it. And so if we were to look at this thing, just from well, first off, we can see all the scatter. We can just see, I mean, I hate looking at these things because you just get this scatter everywhere. They're just not very pleasant to look at. But the very first thing is I'm going to look up here, and I'm going to look at it here, and I'm going to go, okay, it's pretty close. Like, you don't want to skip this part because this one does get off, and I'll show you why. How I like to look at it first, there's 2 ways to look at it. One is to look at it from this axial view. And as I rotate this, that blue line on my pano is going up and down. And I'm looking, do the green outlines kind of hug my teeth here as I'm going up and down? And I'm looking for any discrepancies, and I'm like, okay, there's nothing crazy going on there. But then let's roll through the slices. So this straight up line, as it crosses the let's change it to here. As it crosses the panoramic curve, this line is going to move left and right as I scroll through here. And what I'm looking for is I want to see these green lines. Do they follow the teeth? I'm going to sit here in the anterior for a second because this is important. As I look at the anterior, I'm seeing, okay, it's pretty close. Like I know she has some PFMs here. But watch what happens when I get to the posterior. Check that out. And so thankfully I checked the posterior on this case. You can see that here's her tooth. Here is where the scan is lined up. And so this is a significant deviation where the intraoral scan in the posterior is actually kicked up from the actual cone beam. So if I hadn't have done this and rolled through, I wouldn't have caught that there's kind of an AP rotation here where that is not well lined up. So that is, and if we look, we're here on her, we're here on her left side. So that slice is showing this left molar. If I look over on the right side molars, it's even worse. Like look at how high that posterior is in relationship to the front. So if I only had looked at the incisors, I might have been like, yeah, we're good to go on. But there was a big kick in the back. So that tells me that the software, the automatic software, isn't doing a good job aligning this, which is maybe 10% of the time. And that's where we have to go into our alignment function and choose a different method. Manual is if I wanted just to drag them on top of each other, right? We're not going to really do that. Automatic is what it tried to run. It didn't get that right. So this is where we have to go and do points. And so just like what we had done before with that other model, we're going to kind of slide this to get some of that scatter out of here, at least some of it, right? And then I'm going to hit the points. And now I'll be able to give it some points where I can click equal points and actually tell it to line up there. And then we'll go reconfirm it, and you'll see how much better it does. So I like this case because it really hit that kind of 10% where it's like, it didn't get it. It didn't get it right. But always got to verify. So when we're verifying it, we're going into the cross sections and we're scrolling through the whole pan usually and making sure all the way from the front teeth to the back teeth that it's stitched well. Don't skip that part, otherwise the whole case is off. All right. So what that does is creating like almost like a STL model of the CT, and then we're going to go pick common points that we can see on here and here. So I know right off the bat here that I can see my molar back here just because I've done this case. We can see this mesial buccal cusp fairly well. So if I click that and then I go give it that same cusp tip right here, it's going to find that. Now let's look and see what else. Now, a big part of this problem is this PFMs, are giving me all kinds of scatter on this case. So that's not good. That's ugly. But I can see right here through here. Let's give it this canine cusp tip. I don't love that, and I probably should have turned down the density a little bit. That might have helped. And then I know that I'm going to be able to see back here, these molars back here. And I'm going to give it a couple points. Let's give it this palatal cusp on this second molar. And then let's just give it this distal buccal cusp right here. Okay? So I don't have a whole lot for it to really line up with. But let's see what it does with these 4 points. And it's going to go do an alignment based on those points. And I don't know if you caught that. I probably should did you guys see that model shift a little bit? So it just shifted a little bit. But now let's go back here and let's roll through it. Now look at the back here. Do you see how much better that is? All right, I can live with that. That's fine. That's what you're looking for, is where that green outline hugs that posterior tooth. And then as we roll, we can roll mesially. Oh, sorry. Let me roll the other way. Okay, so we're starting. This is her posterior right. We're going to roll mesial. We're going to get up to the front teeth here. And there we're hitting some of the teeth. So we're close on this one. We're getting a lot of scatter. And it may have been because that canine, I didn't get a perfect view. But in my hands, when I see something like this, I'd be good to proceed forward on this case. This is a full arch case. But and here's my other posterior. In my hands, I'd be good to move forward. You could sit and tweak this a little bit, but for a full arch case like this, I'd be happy with that. But I wasn't happy with where it was prior. The other thing that some people do is they look at, if you have cotton rolls in the cheeks and under the tongue, and you move the soft tissue away from the ridge soft tissue, you're going to get an outline here. So right here is the outline of her palate. And you can see the difference there. If I would have put in cotton rolls up here in her vestibule, you'd get a darkening of the facial vestibule. So that's really good for your edentulous cases, because you will get that air pocket will be black, and then you'll be able to see the gray of the soft tissue. So if you're doing an edentulous case, throw some cotton rolls under the tongue and the vestibule, get the cheeks and the tongue away from the ridge, and create air spaces, and that'll show up a little bit better. All right, so we're going to move forward on this. Let's say we got it stitched. I still hate how much scatter is on this. So this is where we go in and bring in our bone segmentation files. So I can go back in now and I can go and import some more STL models. So these models were created from that service DiagnoCat that I talked to you about, where the AI pulled in the cone beam and it gave me the teeth, it gave me the airway, the skin, the nerves, the jaws. And I brought over just the ones that I wanted to show you guys. And so here's the lower teeth, and it says segmented. Segmented means it converted a cone beam into an STL. So we're going to give that one. Here's our mandible. So you can see how beautiful this model looks. Very clean. It's watertight. It has the sockets. from the teeth in there. Here's our maxilla. So look how beautiful that file looks. So I printed this for this case and actually got to kind of try out and mock the surgery, try my guides on, look at it all. And then our upper teeth. So I can hit control and I can bring all 4 of these segmented models in at the same time. So it's going to pull all these into the case. It's going to ask me, mandible, maxilla, obviously it's asking me for 4. Just hit OK. Now with the auto alignment, hit cancel right away because you don't want it to move. You want it to stay with where it's at. But one of the things that's interesting is sometimes, depending on where these files were brought from, they won't be lined up. So the mandible and maxilla are great, but the teeth are not. So this is where you've got to find your upper teeth segmented, and then you either hit DICOM or direct. So if I hit DICOM, it did that. So it lined those up with the scan. And then I've got to hit the lower teeth segmented and hit DICOM again. Okay. So now we've got this gorgeous rendering of all of our different models. And now we can go and turn off the STL, which is the gray fuzzy stuff. So if under surfaces, we can turn this off. And now just get a really clean view of our patient. And the only reason we can do this is because we paid for that segmentation service. So on a complex case, spend the $50 on a full arch case and do it if you want to be able to really walk through and mock the surgery and do it right. But now I can go and I can turn everything off here, and I can see literally the sockets. I can see the nasopalatine canal running all the way through this thing. And you can actually, now I can actually plan these implants. So like yesterday I did this case and I wanted an implant here and an implant here. That's a lot of times a good spot for these front ones, right between the central and the lateral, right in this lingual bone. But again, my drill would just be like bending right off of that. So I took a round burr and I punched a hole right here and I punched a hole right here. And now when that first drill goes through the guide, it's just going to find those holes and track straight down. And then same thing with your multi-rooted teeth. You can see, kind of visualize your furcation. Really pretty impressively accurate for what it does, 10 minutes just using AI. But you could go print this model. You could do mock surgery on it. You could try your guides on. You could make bone reduction guides on it. So like I could go build a guide over this and actually trim it where I wanted to reduce my bone. And you can actually build a guide that snaps on that when you're doing your bone reduction, you can just kind of take your burr straight across and be really, really accurate with everything. Okay. So the point of this case was to show you how to verify stitching, how to identify poor stitching, and then how to manually stitch, and then just to get you an idea, kind of play with segmented jaw models and how helpful they can be in like a full arch case.